there, I'm Coach Tonya with the Criticalbench Compound and the Strong by Design podcast show, joined by the Dr. Scot Gray. And we're sitting down today talking all about stem cell therapy and regenerative therapy. You don't want to miss it. This was a great conversation, so much information. To watch the full episode, click the pinned comment below. And just to tease you a bit, here's some highlights from our conversation. So, okay, stem cell therapy. Clear it all up for us. What is it?
Okay, so one of the things that, and you look at what the FDA is saying and what the medical boards and things, we have to get really clear about the fact that it's not just stem cells. What's happened is people have taken it and they keep talking about stem cells. It's like this magical little cell that does this, or potion, or then you start getting people that are saying the snake oil type thing, because of how people are promoting it. So it's really a whole encompassing thing of regenerative medicine. Okay, stem cells themselves, they work alongside with a lot of other things. There's exosomes that come out of them that help heal. There's they're anti-inflammatory, right? So stem cells will help to decrease inflammation at a massive level. They release these things called growth factors. Growth factors go in, and really what they're doing is they're actually stimulating your body to regenerate things, right? So it's not, these cells aren't going in, becoming part of you and building a new knee, right? They're not going to go in and just build a new joint. They're going to go in and, along with all these proteins, these exosomes, these growth factors, go in and stimulate your body to start healing itself. And, it can help to regenerate vascularization. So blood can get back to the area, and, we know that can heal the area. So when you look at stem cells, it's not just stem cell therapy. It's this whole envelope of, regenerative medicine. Is really, we're trying to change the language now and say that, it's a regenerative medicine technique that we're using. Stem cells is part of it, but it's not the whole picture. And so, and the FDA has been really clear recently, the most clear they've been, because there's different types of stem cells out there, right? First of all, let's get the ethical issue out of the way. Back in the day, back when the controversy of stem cells, when President Bush was in office, it was, they're using the embryos, all that kind of stuff. And that was outlawed. That's illegal. You can't do that in the U.S. Now, are there countries doing it? Yes, but not here. It's not being done. So that was a controversial aspect. So we don't use any of the embryonic. Then there's the amniotic. So then what they did is they started getting the amniotic sac when a mother had a baby. They would take that amniotic fluid and use that as saying that, hey, there's some stem cells in there, and we're going to inject that. That was kind of when stem cells came on the scene. They started to do more and more research and say, you know what, there's really not a lot of stem cells in there. You can't tell if there's stem cells. Are there these things called cytokines that are very anti-inflammatory that could help people? Yes, that's in there at a very high level. So the amniotic is very helpful to people, but it's not stem cell therapy, right? So they had to take that off the table. So if someone's getting amniotic, we can't say it's stem cell therapy because they don't even know if there's any in there. Then there's placentas. Some people are taking the placenta then from a birth, and they're taking out cells from there and injecting those. And it's kind of like the amniotic, where you can't tell how many cells are in there. It's just a lot of debris. And so they're moving away from that. And then there's the umbilical cords. So the umbilical cords is what we use. Now, this has changed a lot, though, because there's different aspects of the umbilical cord. And sorry, I skipped over one. Let me just step back for a second. And that is autologous. That's using your own, right? So they can go in and take it from your body and inject it back in. There's a couple issues with that. First of all is, now if you're a young person, let's say an 18-year-old gets an injury in sports, using his own cells or her own cells would be the best possible therapy that's out there, right? But when you show them that giant needle that they're going to have to crack open your hip and take it out of your bone marrow, a lot of people, it's a surgical procedure. And so people don't like that. It's expensive and painful. Sometimes they'll have to do multiple draws. And so that's the biggest reason people don't like to do autologous. And then the other thing is the older we get, then we're using our own cells. And the reason we're not healing is because we don't have as many stem cells. We don't have as many cytokines. We don't have all this stuff that we did when we were young. Right. So autologous, the older we get, once we get up to 50, 60, 70,
it's not as effective.
We don't really want to use our own. Personally, I wouldn't. So that's when they started looking at umbilical. And so here's what happened is mothers were having babies, and there's babies born every day, and they're just throwing the cords away, right? And so this was really medical waste before doing this. And so they actually started banking stem cells, and a lot of mothers know that you've been asked, like, do you want to store your stem cells or your umbilical cord for your baby? And they started that about 35 years ago. Actually, one of the first companies to do it was in Tampa. And they started storing these things because they started to see that, wow, we could use these down the road for whatever issues may come up, a genetic disorder and those types of things. So they started doing that. And they studied more and more these umbilical cords and how do we get the cells out. And so that's the real thing today is the manufacturing process of how they get the cells out. And there's this thing with the FDA is it's either a drug or it's not a drug. It's just a tissue, right? And these manufacturing labs, what's happened is we've been able to get it under this premise that it's not a drug. Well, there's something called cord blood, and that's actually got some of the blood in it, right? And so there's a process they use to get the stem cells out with the blood, but now the FDA came out literally a few weeks ago and said, you know what, we're classifying that as a drug. So a lot of the labs that have been using it, we can't use cord blood. So they're taking that off the table, all right? Now, some people are still using it. They still say there's some question out there. But what it looks like is that the FDA is going to say, no, that is a drug. Now, the way that we'd be able to use it is if they do a study, just like with any new drug. It's called an IND, investigational new drug study. And if the labs can get that done, we'll be able to get cord blood again. So what they would do is they would say, hey, we're going to do a study on osteoarthritis with this, and then they would have to get that approved. So it looks like right now cord blood's going to be taken off the table, okay? So, and that was the main one that we used. That was my favorite. It's the one we had the most success with. There's this other thing called Whartons Jelly, okay? Now, what this was is more of actually the tissue of the cord. So it's actually part of the cord itself. Now, the great thing about this is that this tissue has the highest level of mesenchymal stem cells. If people have heard of these MSCs or mesenchymal stem cells, these are the stem cells that we want. And this tissue has the highest concentration of mesenchymal stem cells of any tissue in the body. It's about 30% mesenchymal stem cells. The problem is the way that they've always processed it is kind of like this grinding up of the tissue. And it's kind of killed all the stem cells in the process. Well, I found a group that has found a way to process it the right way in America that keeps the integrity of the stem cell while using it, okay? And the way that they've done this now is that we can actually do the treatment, and the FDA classifies it under a tissue. So just like it would a heart transplant, it says that when you take a heart and transplant it, it has to be used for the exact same thing as it was in the donor's body, in the recipient, okay? So now the way that they've done this with this new tissue that has the MSCs in it, we can do it. And then we put it in as cushion and stability for that joint. So the joint can then, get some cushion in there. It can start to heal again. And that tissue's packed with MSCs, cytokines, growth factors, all these amazing healing things in the tissue. And so, again, when we talk about stem cell therapy, really what this conversation is moving into, at least right now, and if it's not under a drug study, it's going to be more of like your osteoarthritis type of patient, where we put it in for cushion and support and let that tissue do what it does to heal the body and really invigorate your body.
So like a catalyst.
To get your body. And Dr. Reardon, who's been one of the pioneers in this down in Panama, he's got a great clinic down there, has done amazing things. He talks about the fact that MSCs, when they go in, not only can they do some things to help you, but they turn your cells back on. It's kind of how he puts it, right? So it's like taking your cells that have kind of been lying there dormant and waking them up and getting them going again. And so what they found is that they believe that that's why when people get stem cells, that it's in this regenerative process. I've had patients that have gotten stem cells and have just waited and waited and waited. And like, this thing isn't working. It's not working.
Yeah.
5-6 months down the road, wake up, pain is
gone.
Just gone.
Yeah.
Just gone.
It's a healing process inside the body.
Right. And so what they're saying is that when, those cells aren't around for 6 months.
Yeah.
So what's happening? And what they're saying is going back to what Dr. Reardon has found, that, it can turn cells back on. Well, your body gets turned back on, and then it heals and heals and heals and can continue to do that healing. And then, and again, this is theory. I don't have a double-blind study that says that.
Right.
We just have these experiences with patients. And, we just have to be, one of the things, when it's not a drug that's been cleared for anything FDA, I can't say I treat osteoarthritis. I can't say I treat this or that. All I can tell you is that we can put it in for cushion and support, and we know it can help the body heal.
Right.
And that's really what we're focused on doing. And the whole premise, and this kind of goes back to my personal faith, and that is the power that made the body is the power that heals the body.
Absolutely.
That's one of the big things that drew me to stem cell therapy is that it's like, wow, it's these cells that go in and are part of the miracle of life. These are the cells that are in the umbilical cord that go in and help this whole process of the miracle of life, and something that, scientists have done some amazing things and made some amazing drugs, life-saving drugs, things that have really changed people's lives and changed the health of our country and the world. But no one's been able to figure out how to make a baby, right? The miracle of life is still something that
is beyond science.
It's beyond science,
really.
Right?
Yeah.
And I feel like, again, in looking for something, like, where could I find something that's beyond science, right?
Yeah.
And I've always been more naturally minded.
Yeah.
And so how could we do something and harness that? And I was like, wow, they're harnessing that power and putting it back in. And again, we don't make claims that we're, healing a person. We have to just say what it is that we're doing. Like when you're doing a heart transplant, you're taking the heart and you put it in there. We're taking the cells, we're putting them in the joint, and we're letting your body do what it does.
What it knows to do.
Right. Yeah. Just like when you put a heart in, it knows
what to do, right?
It starts pumping and starts doing its thing. Yeah. And that's what we're doing. We just let it do its thing in there.
So, and I can only imagine, it's not something I've looked into really deep as far as like, for myself or for a family member, but I would imagine there, it's not a cheap therapy to get. So for somebody that would be looking like somebody that's, looked after themselves, has done that, was just like, I'm at that point where I need something like this and I really want to investigate this. Where could you like sort of give us some bullet points or checklists where and how to even start? Because like you say, it's like anything there, there's good schools and there's not as good schools. There's really great clinics and not really great clinics. There's good lawyers and not great lawyers. So where and how can they start to at least get on the right path with the right people that it'll direct them to the right for them,
Yeah. I mean, so, and everything that I've done, I have a very large network of doctors. I work with a lot of doctors on how to run their business and how to do the stem cell thing. And some of the things I'm talking about right now, about what we can say and can't say, and really what we can treat, and, just so people are doing it the right way. I help people do that. So I've got a very large network that we could help connect people. I mean, even if you just looked at our website, Stem Cell One, it's stemcell1.
There's tons of stuff there.
.co. So it's just .co. instead of .com. So stemcell1.co. If you go there, look at the information, contact our office, and if you say, hey, I'm in Dallas, Texas, I need someone, I know docs in just about every city across the country that we work with, and I know the ones that are using good product,
yes,
and people to refer to, and our team is always happy. I mean, we've got, I've even got a call center that we, help, answer questions and things like that. So if they just get a hold of our office, we'll be more than happy to, find someone in your area.
Okay,
yeah.
So you heard that, folks. That's stemcell1.co.
Yep.
Okay, and because I have been on the site, there is a lot. I mean, it's the one place to go to for your start.
Yep.
Yeah.
And it's spelled out one, not the number one.
Yeah,
spelled
stemcell1.co.
Yep.
So I do want to ask you, because we, here at Criticalbench with our company, we are all about helping people live in a great state of wellness and health and fitness. So we're constantly making products. So we got YouTube videos and all of that. So we have things like our forward head posture fix and unlock your hip flexors products that we have for sale for people that are, starting to feel the aches and pains of whether it's, lifestyle or age or whatever injury. Do you see value, like in terms of, again, like, if you live a very sedentary lifestyle, it's one of the worst things you can do. It is the new smoking. It really is.
Yep.
So your body, if it isn't doing what it's meant to do, it's going to seize up.
Yep.
Things aren't going to move. There's so much activity going on inside the body that the minute we stop it, all of that kind of slows down. Do you see value in, things like this for people to use to keep themselves mobile and moving it, so that when it gets to where there is an issue, we can actually look at it and go, okay, you know what, this is something that needs further something more in depth?
Yes. Yeah, absolutely. So it's funny that the things you have sitting here is hip flexors and the forward head posture fix. These are the two things I always talk to my patients about. Because
we're always talking about these two things because they're huge.
Because that's what everyone had.
Yeah.
One or the other or both.
Yeah.
Okay. So with the forward head, we call that upper cross syndrome.
Okay.
And this is lower cross syndrome. And so what happens is the way people sit to watch TV, to eat, to work on their computer or whatever, what happens is the cross means that you get tight muscles and weak muscles. Right? So you've got weak neck flexors, right? Which actually, when your neck flexors in the front are weak, your head will come forward. You don't keep that curve. And then you get the tight cervicals here, okay? And then you get the tight traps.
Yes.
Right? And you've got weak mid traps. So you've got this cross of tightness and weakness that just holds your head there. And then all of a sudden the degeneration happens. So it's the years of sedentary life, the way we've done things, just normal life that's caused that. And so something like this, going through something like this can reset that, right? And then the hip flexors is the same thing. When we sit, we shorten our hip flexors, right? So when we're sitting, our hip flexors are short, we stand up, and all of a sudden, see, those hip flexors come off of your spine, right? The lower part of your spine and sacrum, and you stand up, and all of a sudden it's pulling on your back, and it's like,
you're walking all standing crooked.
What just happened? So, these two things literally are responsible for, I don't know how high, probably 85 to 90% of what I saw come in my office with headaches, neck pain, back pain, sciatica, was these issues. They were at the core. Yeah. So, we always went back to the cause, right? What's the cause? And so, I may see that your foot's pronated, or I see that, your sacrum is off, but typically at the core were these issues.
Yes.
And so we had to work on these so that we could get you balanced out. So as we line things back up, they stay. Because if I don't, you're going to keep doing that.
Right.
And so if, you've gone to a chiropractor and you're like, oh, why doesn't it stay longer or whatever? Now, we always do things to knock it out. If you look at research, they say that and all the research done on manipulation, if you go every 2 weeks to a chiropractor, your spine will be in the best condition it possibly can be. But at the same time, with a lot of us, if we don't fix these, it's back the next day. Right. You won't make it 2 weeks. So when you do this is when you can get longer lasting results. And it's one of my favorite quotes I say a lot is big doors swing on little hinges. Yeah. So you ignore this stuff, that's where the degeneration comes from. And that's where you don't wake up one morning and all of a sudden like, oh, I need back surgery today. Yeah,
it happened over
a lot of years, right?
Yeah.
And when you should take action is before it hurts. Right. I mean, our dentists have done so well to teach us, like, we brush our teeth every day, multiple times, because we don't want something bad to happen, right? But when it comes to the rest of our body, we just ignore our back. And it's like, if it's tweaked, we'll just cover it up, right? Yeah. You know, it's like when our teeth are gross and grimy, we don't just cover our mouth with our hand. We brush it and we fix it, right? Yeah. So you should be working on your back and your body with this postural stuff is key. Yeah.